If they have one of these on, you don't have to clean it. It's clean. If they don't have one of these on, you take an alcohol swab. You just clean the lure lock off here.
They don't have the lure lock on? Oh, sorry, I got distracted.
Oh,
what did you say earlier?
This is just a cap.
Oh, okay.
If this is on, it's clean.
Okay.
Because it's got chlorhexidine in this little hole here. If not, you just clean it with alcohol.
And then.
Get your flush.
Oh, okay.
And then just flush it gently. If you feel a little bit of pressure, sometimes this will clot up a teeny bit, and you have to put just a little bit of pressure through it. If you feel like a lot of pressure, there's probably something wrong. It might be kinked. If you can pull back blood, that means you're 100% in the vein. Like there's no question that you've got good access. A lot of times they won't pull back, especially if they've been in for a day or two. That doesn't mean there's anything wrong with it. You just flush it. You want to make sure nothing puffs up here in the vein. Sometimes the patient, they'll feel a little bit of a sting when you flush it, just because this is basically salt water. But a little bit of a sting at first is normal. If they feel a lot of pain, then you got to kind of figure out what's going on. And that's it. At the beginning of shift, you always want to flush your IV just because you want to make sure you have access for the rest of the shift. You don't want to be like at 10 in the morning figuring this stuff out and be like, oh, I got antibiotics to give and I don't have an IV. So I think that's about it for placement. Any questions at this point?
When it comes to placing the IV, like you said, I mean, when we're doing IVs, would you ever just do an IV like this?